Hi everyone, my name is Elissa Moore. I am an occupational therapist at Pathways. Thank you all for joining our webinar on sensory issues in children, developing your child's senses. The structure of today's webinar will be a brief presentation on our senses, followed by questions and answers. We are incredibly thrilled to have Dr. Susanne Roley co-hosting this webinar today.
Hi, Elissa. Thank you for inviting me.
Yes, thanks for being with us. And everyone, as you can see by this slide, Susanne is definitely an expert on sensory integration. Susanne studied under Gene Ayers. Dr. Ayers was an occupational therapist and educational psychologist who was known within and outside the field of occupational therapy for her pioneering work in sensory integration. Susanne's experience reflects over 30 years of commitment to the health and welfare of children and families through occupational therapy practice, education, and research, primarily through her expertise in the area of sensory integration. An international lecturer and author, Susanne is clinical adjunct faculty in the Chan Division of Occupational Science and Occupational Therapy and travels worldwide educating healthcare professionals about child development. Her private practice in Orange County, California, consists of occupational therapy, consultation, and evaluation services, specializing in pediatrics with a wide variety of abilities and diagnoses, including visual impairment, autism, regulatory disorders, and learning difficulties. For those of you not familiar with pathways.org, we are a not-for-profit founded in 1985 that empowers parents and health professionals with free educational resources on the benefit of early detection and early intervention for children's motor, sensory, and communication development. All of our resources are available online. In the sensory section of our website, you can find a checklist of sensory milestones, videos on sensory integration, handouts, and brochures, all of which are free. This webinar will also be available to watch as a video in approximately 2 weeks on our website. So let's begin the presentation so we can get to your questions at the end. Sensory integration. This refers to the process our brains use to organize information received through our senses. Most people are familiar with the 5 senses: taste, smell, touch, hearing, and sight. But we actually have 2 additional senses that we use when interacting with our environment. One of these additional senses is the vestibular sense. The vestibular sense is responsible for movement and balance. It helps us maintain an upright position and lets us know how fast our bodies are moving in space. This sense allows us to perform activities like walking without falling and riding a bike. Another additional sense is called proprioception. Proprioception is our body position sense. It gives us information about where our body parts are in relation to each other and helps us know how much force to use when picking up an object. Proprioception is why we can touch our nose with our eyes closed and why we can crack an egg without smashing it. Most activities we do require us to combine information from many different senses at the same time. For example, a toddler uses touch to explore the texture of his food, proprioception to bring the food to his mouth, and smell, taste, and sight to identify different types of food. He also uses the vestibular sense to sit upright during the meal. As they grow, children learn how to take in and process all this information at the same time and focus their attention on particular sensations while ignoring others. It can be very overwhelming for children who have difficulty with this process. However, some children may have difficulties receiving and processing incoming sensations, making everyday tasks frustrating. For instance, one presentation of a sensory integration issue is having a hypersensitive tactile or touch sense. While we often think of the tactile sense in terms of things we touch, It also refers to the things that touch us. Right now, think about the shirt you are wearing. Is it soft or itchy, tight or loose? Now that we're talking about it, you're probably very aware of the way your shirt is feeling against your skin, whereas before you didn't even notice it. Children with tactile hypersensitivity are constantly aware of the way clothes, tags, and jewelry feel against their skin, making it very difficult for them to focus on other tasks. A sensory integration issue can present itself in many ways. I'm going to talk about a few red flags that could indicate a sensory issue in 2 to 5-year-olds. Children with sensory integration challenges can have delays in their motor, speech, and language development. They may be late walkers or may only walk on their toes. They may not respond when you call their name, and they may have very few words by the age of 2. While almost all children in the 2 to 5-year range can show signs of hyperactivity, children with a sensory integration issue may find it impossible to sit for just 1 or 2 minutes. They may have a constant urge to crash into things or jump and climb. But on the other end of the sensory integration spectrum, some children with SI challenges may show no interest or be overly fearful of physical or social activity. We're now going to play a video on some more signs of a sensory issue and what parents and caregivers can do to help.
Watching your children grow and play is one of life's greatest pleasures. It's exciting to watch them use their senses to decode the world around them. But for some children, their senses may not be sending the information to the brain correctly. Their behavior can look under or overreactive. They may seem fearful or disorganized. They may have problems reaching physical milestones, socializing, or learning. If this sounds like your child, he or she may have a sensory issue. Recently, a panel of leading occupational therapists joined together to provide answers to common questions about sensory issues in young children. Here's what they had to say.
There's an explosion in the number of children who have sensory differences affecting their learning and behavior. The earlier you can get help for these issues, the better everybody is. It does not make sense to wait, and the research is very clear on this, that that they'll grow out of it is a fallacy.
We usually think of 5 senses: sight, sound, touch, smell, taste. But there are actually 2 more senses that are also very important. One of them is the sense that tells us about our body position. If you put your hands behind your back and spread your fingers apart, you would know that your hands are in that position because of the information from your muscles and joints. This sense is called proprioception. And we have another sense that gives us information about movement. It helps us to move in a smooth, coordinated way, to maintain our balance and to adjust our eyes while we are moving. This is called the vestibular sense.
We're all constantly taking in sensory information and using that sensory information that we're getting from the world around us. And some of us might be better in some areas than others, like some people might have really good hearing or better vision, while other people might maybe have better body position sense or movement sense. But we're all pretty much able to hopefully be functional. And that's what we're looking for the children we're treating.
Sometimes it's hard to tell what a sensory issue looks like because no 2 children with a sensory issue act exactly the same way. Parents are typically the first to notice that their child might be doing things differently.
At his 9-month wellness checkup, he wasn't crawling and he wouldn't stay on his stomach at all.
A lot of times, like the gross motor coordination was never quite there, and the doctors would write it off at first as, he's a boy, he's clumsy.
He might attempt to try an activity, but as soon as the other children would just run by him and climb on the slide and get on the swing, and they would have done it like 10 times before Ryder could even, get to the stairs, he eventually just started to avoid activities like that.
Every day, our brains effortlessly take in millions of pieces of information from the outside world to help us learn, play, and work. For most of us, these messages enter the body through our senses and speed like a fast train to the right places in the brain to help us react. For some children, these messages don't have a smooth trip. The train gets stuck, follows the wrong signals, or moves slowly along the tracks.
there are times when others are interpreting those behaviors as being malicious. Often they're accused of purposefully breaking toys, being too aggressive, and not then being invited to play dates or to birthday parties or even wanting to interact on the playground.
You could have a child that is very, very sensitive to, say, auditory or sounds. And it might look to people around them that they're not really paying attention, when actually what they're doing is they're paying attention too much.
And it was more frustrating definitely before we knew, because then we're like, why is he behaving like that, and why is he why is he acting up like that?
We didn't like the unexpectedness of being splashed. Really stayed away from sprinklers, swimming pools. Taking a shower was just something we couldn't even think about doing for him.
One of the ways that I describe sensory difficulties to parents is by talking about getting glasses. You know, because everybody goes to an optometrist for an eye check, and if if you don't see 20/20, the optometrist will give you glasses, and that's a wonderful way to change your visual perception. You know, the way you see. But we don't have glasses for the other senses. That's where sensory integration intervention comes in, because we try to provide activities that will enhance the way the child perceives those kind of sensory inputs.
Therapy sessions use swings, climbing structures, big pillows and bolsters, and tactile activities. The activities might include things to push, pull, touch, climb over, jump on, or jump from. Obstacle courses are another popular activity. Therapy is a lot of fun, but kids are actually doing a lot of hard work.
I don't think James realizes that this is therapy, it's just playtime.
I feel like before we come into a session, he's definitely excited. He knows when his scheduled therapy day is. He knows it's on the calendar. He can't wait to come.
And now he walks in the grass, and before he couldn't even touch the grass. And yesterday I was chasing him around a tree, and we were both in barefoot, and he was just having a great time. And 3 months ago, this wasn't possible.
You'll sit there at a swimming class like, holy smokes, he's actually doing it just the same as everyone else. It's just an absolute triumph for us.
Clearly, we've seen the benefits of sensory integration therapy with our son. It's helped him improve in all areas of his life, and we know it will continue to help him, and we just feel so grateful that we got the help for Ryder when we did.
It's really important to start as early as possible, but it's also important to know that some of these issues are really hard to detect, and that you might not notice it in your child until they are in grammar school and they're starting to have trouble in the classroom.
The reason that we really want people to know about sensory integration and know about it now is so that you can get help as soon as possible for your child. But it's never too late.
In the end, it's all about helping them be happy and successful kids.
As we just saw in the video, occupational therapy can help children with sensory integration issues by giving them tools to better process the sensory input they receive. Occupational therapy can also help children improve play skills, self-care, and fine motor skills in addition to sensory processing. Now we're going to play our next video on one little boy's experience with sensory integration issues and how occupational therapy helped him.
Meet Ryder. Ryder's story demonstrates the value of early detection and early intervention. At an early age, Ryder had difficulty interpreting information received by his senses, which resulted in a referral for therapy services before the age of 1. Watch his journey through therapy as he becomes more comfortable in his body and unlocks his true self.
Ryder began therapy at the age of 5 months. Ryder had a really difficult time lifting his head, and he also had a really hard time during tummy time. We did intensive tummy time with him, and there was never any kind of improvement. He couldn't lift his head, he couldn't push up. He also just didn't move very much. Something was just a little bit off, that he wasn't really making any kind of progress.
Every child with difficulties processing and integrating sensory information displays a different set of concerns. By looking at Ryder, we can get a better idea of what sensory challenges might look like for a 1-year-old. Ryder had difficulty coordinating body movements to meet milestones such as sitting up and crawling. He fatigued easily, was often apprehensive in new and unfamiliar situations, and cried when he was overwhelmed by sensory input. As he grew, new concerns emerged about his abilities playing and communicating with others.
Whenever we'd have a play group or go to a playground with other children Ryder's age, he had a very difficult time keeping up with the other children, and he might attempt to try an activity, but as soon as the other children would just run by him and climb on the slide and get on the swing, and they would have done it like 10 times before Ryder could even, get to the stairs, he eventually just started to avoid activities like that.
Something seemingly fun and carefree, such as playing in a playgroup, made Ryder fearful and anxious. He struggled to keep up with the other children and was often startled by their quick movements. As a point of reference, Ryder and the child circled here are the same age. Ryder struggled to enjoy physical activities. Notice that he has difficulty moving fast enough to participate with the group. He also struggles to communicate with peers. A child at his age should have a vocabulary of at least 50 words, which are used to form 2 or 3 word expressions. In addition to difficulties playing in a group, Ryder also had a hard time when the environment was less overwhelming and the play involved just one other child. You can see that Ryder is a smart child. He understands a lot, but because of the sensory overload, he is not fully expressing himself. As you have seen, Ryder's sensory issues impacted many areas and made everyday tasks frustrating and tiring. To help Ryder, he received a comprehensive therapy program specific to his needs, which included occupational therapy, physical therapy, and speech-language therapy, as well as a therapist-prescribed home program, all focusing on increased participation in age-appropriate life skills and activities. In therapy, Ryder participated in activities that were fun, intrinsically motivating, and provided rich sensory experiences. These experiences helped Ryder better detect incoming sensations and make better use of information he received from his environment.
Ryder's worked so hard in therapy to be comfortable with his body and to do multiple activities at once and to enjoy himself at the same time. And so now he's able to do so many things, and to us it might look effortless, but to him he's really working very hard in everything he does. But he's making so much progress that he's able to be in group situations, and he's with his peers, and he's keeping up with them the best that he can, and he is enjoying himself.
Watch how Ryder progressed and how he has become more comfortable in his body and the world around him in a play session with a child his own age. He has become more confident in a sensory-rich environment. He is able to balance on the roll, use fingers to remove stickers, and participate socially. He is simultaneously initiating language, stringing multiple words into phrases as he engages socially with his friend.
Baby, you want a baby tire?
He does all this while smiling, laughing, and fully enjoying these age-appropriate activities. These wonderful gains show improvements in organizing, interpreting, and responding to sensory information. When children are not overwhelmed by their senses, they experience improved behavior, better coordination, and lower anxiety. Kids can be simply kids, working and playing alongside friends, and participating more fully in life. With the help of his family and therapists, Ryder made tremendous progress and is growing into an energetic, happy, expressive, and confident child.
Clearly, we've seen the benefits of sensory integration therapy with our son. It's helped him improve in all areas of his life, and we know it will continue to help him, and we just feel so grateful that we got the help for Ryder when we did.
Before we move on to questions and answers, I'd like to talk about some simple activities you can do to help support children's sensory development. Shaving cream is a really popular tool for occupational therapists. Try spraying some on a table and encourage children to get messy by drawing in the shaving cream with their hands or with brushes, spatulas, or plastic spoons. Filling a plastic tub up with dried lentils is also a fun way for preschool-age children to use their sensory integration skills. having children put their hands in the bin, and describing what it feels like. You can also encourage kids to feel the lentils with and without gloves on for an even richer sensory experience. You can help children develop their proprioceptive sense by leading activities like imitating different animal walks, doing jumping jacks, dancing to songs like the Hokey Pokey, or using playground equipment like the monkey bars and slides. Cornstarch and water, or oobleck, is another way to create a new sensory experience for children. Fill up a tub with cornstarch and water until you get a consistency you like. The oobleck won't have a uniform texture. Sometimes you'll pick it up and it will run, and other times it will glob together, making it a really unique sensory activity. Water sensory bins are endlessly entertaining and help children get used to the feeling of being wet. Fill plastic tubs with a few inches of water and throw in sponges, pitchers, toys that float, and sink, and whatever else you think would be fun and safe. We would now like to answer some of the really good questions that you guys have been sending in. The first one we have here, I have groups of kids who constantly put everything in their mouths. Can you provide suggestions of activities to help this?
Sure. I think we want to talk a little bit about why children might do that, because this is something developmentally we see all children do. So in infancy, as soon as they're able to move around or reach, they start to grab things and put it in their mouth, and that's because the mouth is an amazing spatial sensor. It gives a lot of data. There's a lot of nerve endings in there, and it gives information about texture, size, weight, shape, that then maps to the rest of the body, what they see, what they're feeling with their hands, what they feel as they bang this object on the table, and those multisensory maps get created so that in the future, if they have something in their mouth, they can easily decode whether it's food item, non-food item, the size, the shape, the texture. Now, the problem comes when children are potentially putting unsafe or unsanitary items in their mouth. So even in that early infancy, parents have to do a lot of lifeguarding to make sure that nothing gets in there that they could choke on, or that they don't have anything dirty in their mouth. And that just requires constant vigilance, and that's for all children. The other, and that would be true of anybody of any age putting things in their mouth. But as these children get older, and you expect them to diminish the amount of things that they would put in their mouth, so you think, okay, maybe when they're 1, all right, that's okay, you know, up to 2, maybe they're teething, but beyond that, we're really thinking that these children should extinguish that. They should not be putting things in their mouth anymore just to explore it, to learn about it, because they should be able to do that now through touching or seeing or hearing. So if they're doing that beyond these age ranges, I mean into the toddler, into preschool years, then we start to be concerned that maybe they're not getting enough information from these other sensory areas, like you mentioned, the tactile system or the proprioceptive system. The other thing is that when we see children putting a lot of things in their mouth, the other thing that might be happening is they might be anxious, and they might be using it to self-regulate. Now, we'll see adults do that too. Like you're writing a paper and you're thinking about something, and you find that you're chewing on your pen, or or you've gotten a little crunchy snack to eat because it somehow helps your concentration. We also see this. So what do we do about it? Therapeutically, what we would want to know, first of all, is why, what is our hypothesis about why the individual is putting things in their mouth? What kind of need is being satisfied? And then provide sensory opportunities that are, safe and acceptable in the situation that they're in, so that they get that need satisfied. If it's looking for more information through their mouth and exploring objects to learn more about them, then maybe they could have something like jewelry, or those are little little rubber kinds of things that they could wear. They could buy them through catalogs. Those are available to families. And then you could do things like chewing on ice in school for a little older child, maybe, depending on the person, maybe gum is acceptable at different times of the day so that they're getting their oral needs met, but in a more acceptable way.
That's wonderful. Thank you so much for the explanation and great activities and ideas that can help that situation. Our next question is really great. I have several kids referred to occupational therapy in my classroom for behavior that includes head banging on the floor, biting, and hitting. Can you provide suggestions of sensory type activities that may help decrease these behaviors?
Yes. You know, the head banging is quite concerning. Of course, you know, we'd want to replace that with something that is safer. I mean, at all times we want the kids to be safe. But my first thought is that as an occupational therapist, I have sensory tools, but I would want to know medically, is there something making that child uncomfortable, and maybe banging the head is taking away maybe a pain or you know, something like a migraine or ear infections. We don't always know, depending on the individual. Especially our clients who are nonverbal or have autism and may not feel pain in the same way we do. I would have concerns. Maybe there's something else going on, and that's why they're having these behaviors that we find so concerning. So that's one thing. You know, let's consult our medical professional. Make sure that there's nothing else going on medically with their gut or with a headache or with their ears, nose, throat, that kind of thing. But from a sensory set of strategies, what we think is that that's very often a proprioceptive seeking set of behaviors, the ones that you described, or they're seeking tactile deep pressure input. And the way that we would handle that is by giving that individual more of those things, but in a more typical fashion, or in ways that are for sure not going to be, you know, harming them, like head banging. So one of my favorites is to have children wear garments or undergarments that are kind of close-fitting, or like little lycra tights, or like dance clothing, maybe even underneath their skirt or pants, or, you know, for boys, some of the athletic gear, like the you know, like the lycra underwear and undershirts that you might have available to you for any athletics. And that seems to give the children a sense of just being contained a little bit, and it calms their tactile systems down. Having opportunities to lay down, get inside, you know, between maybe two big beanbag chairs. Sometimes the kids like pressure, or to have some heavy weighted stuffed animals, like a big heavy lizard or something, just certainly not anything that would be like a restraint, but something that would just give them some pressure that helps them calm down. More actively, something like a trampoline or a chin-up bar, depending on the person. Again, you know, those might be other outlets for them to get that traction, compression with their proprioceptive input, but maybe in more acceptable fashion.
That's wonderful. Thank you so much. Next question, I think, is one I know I get asked all the time. What do you recommend to help kids sit for circle time or story time in preschool when they really struggle with that?
Oh, that's really, that's a good one, because we definitely have children who are really struggling with circle time. You know, I probably have to go through all the senses, right? Because you know, I mean, and I get also back to our assessment. You know, we would want to do an assessment to find why any of the children are not doing that, because there could be 15 different reasons that a child might not be sitting in circle time, and and you have 15 children in your class and every single one is different, you know. So, so first of all, in terms of their distance learning, at circle time you're hoping that they're going to watch the teacher, follow along with the teacher, listen to the teacher. And so if the child is not accessing the visual environment very well, then of course, you know, moving them up closer so they can see a little better, that's a good one. If there's too much moving going on, they might not be able to look at the one thing they're supposed to look at versus everything else and all the other moving parts, including the other children. So the visual distractibility could be another one. We see a lot of children with auditory processing deficits, and it might be if the teacher is doing a lot of talking and with not coupled with the visual supports, that child might be very distracted and not really very interested anymore, and so they might get up and wander around. So, so the distance learning, supporting the distance learning by having, you know, multimedia, both the visual and the auditory, and then ensuring that that child understands what, you know, that they can actually repeat back. Did you hear what I said? Can you see what I do? Or, you know, can you do that? Because the other thing that children might have some dyspraxia, and so if they're looking, if they're watching and you're saying, okay, follow along with the song, and here I want you to make your hands do this, I make your body do that, they may be really lost because they need to have it slowed down or deconstructed in a way so that they can maybe learn those moves before circle time happens, and that would be a nice collaboration with the family. Another reason, a very common reason that children can't sit still during circle time is because their vestibular systems aren't working very well, and that's the system, the receptor is in the inner ear. It's responsible for posture and balance and just telling you where your head is relative to gravity in space. And when that system is underreactive, a lot of times children try to move more. They move more because they don't kind of feel the pull of gravity, they're uncomfortable with the pull of gravity, and so holding still and sitting upright for any sustained amount of time is really problematic. And I know that the preschool teachers out there are going to see those kids that really can't sit crisscross applesauce. And so you see them getting up on their knees, or they're W sitting, or they're falling over, and that is very likely indicative of this poor vestibular postural control. Another thing that might, you know, as I go through the senses, the tactile system, if you have a child who's under-responsive to touch, maybe they're kind of getting in each other's space, you know, so they're sitting too close, maybe they're sitting on the other child's foot and they don't even seem to notice it, and the other children are pushing them away, and the next thing you know, they're distracted by what's going on around them versus paying attention to the instruction of whoever's leading the circle time. If they're over-responsive to touch and you put them in the middle of the group, maybe they really can't handle that. They are so distracted if somebody's touching them, and then, oh, they hit me, and I don't like that, and then you see them moving away from the group, out of the group, to the side of the group, to the back of the group. And those kids, it's really nice if you put them sort of at the edge, not in the middle of the group, but at the edge of the group, so, and they can see everybody, but they don't have to have a lot of unexpected touch contact from their peers. So I think those are probably the big ones. Proprioceptively, if children are really seeking a lot of movement, or really not having very good body awareness about grading the force and direction, you may see them, you know, hit the board too hard if they've got the pointer, or they sit down and they miss and they're falling over. So you may see some fine and gross motor irregularity with those kids with circle time, and you know, that's a problem. And so what do you do with any of that? I think the accommodations that we would make during circle time, one is to, for the tactile, vestibular, and proprioceptive, is just note where they have to sit, you know, in the group. Give them frequent movement breaks. Maybe don't have them do floor sitting. Floor sitting is hard for a lot of children, so even a little cushion or a little cube chair, have the weighted little stuffed animals that they can put on their lap, or a cushion that they can put under their bum. And then frequent breaks, so that you sit a little bit, you stand a little bit, you sit a little bit. Maybe they go, and they're more actively participating during that time, and also the visual schedule, so they know what to expect.
Yeah, these are all great suggestions. It's amazing what has to come together for kids to do something that may look simple, like sitting down with his peers.
Yeah.
I mean, it's incredible what has to come together inside. So thank you. Next question could be kind of an intense question, but because you are a researcher, so I'll just throw it out there for you. Could you talk a bit about current research supporting occupational therapy using a sensory integration approach, and what do you recommend saying if a professional is possibly challenging why your student or your child is participating in therapy that involves a sensory integrative approach, or if you're recommending it?
Well, I think that's a very important question, because all service providers are being asked to be evidence-based, and for very good reasons, for accountability. And occupational therapists using sensory integration for many years have been asked, okay, let's really get a lot of evidence that what you're doing makes a difference, because some of the therapies we're asking for equipment and space and time, and how do we know? Well, and I would say that professionally we have matured in the quality of evidence that we have supporting our methodologies, and also the quantity. So the theory of sensory integration is based in neurology and in biological sciences, and it seems that we're more sophisticated now in our understanding of the contribution of sensation to function in general, from a neurological standpoint and a developmental standpoint. And so those references are taken from many different fields, and also being built within the profession of occupational therapy. The next really important piece is the identification of the kind of problems that we're working on. So, we certainly would never say everybody's going to benefit from therapy, right, occupational therapy. Now, certainly a rich and lovely sensory life, yes, we think everybody should have that. But when you start talking about therapy, you want to go in and really use the most rigorous assessment tools you can to identify those problems. And then when those problems are identified, then have a treatment available. And we have been building a body of science that identifies the patterns of sensory integrative dysfunction. There's not just one kind, there's many kinds, at least 5, probably more. But we have current evidence from factor analyses and some older cluster and factor analyses that are very strong studies showing us the patterns, and we know how to identify them from assessment. And then the third, well, and I think we have the fourth too, the outcomes, but the intervention itself now is quite well defined. And we didn't have that for a while, but now we have identified the need for a manual for this kind of intervention, and a way that we can test whether therapists are using this well. And we have AIRS SI fidelity measure for intervention, and we have used that quite successfully. And now there's 3 published papers on that for the reliability and validity of the instrument, and it's quite high, and that's been very helpful for us. Because now we have several randomized clinical trials, and there are 4 that I can think of right off the top of my head. There's probably more in process, and all of those have shown gains in very substantive areas of concern, including educationally related outcomes, socially related outcomes, skill-related outcomes, self-care, self-direction, less caregiving required, intensive caregiving. So these are very relevant outcomes, and so we're starting to have a a body of literature in current literature that is really showing what I think we saw anecdotally, but maybe we didn't have strong enough numbers. I still think we need more, of course, we need a lot more research. We need to know, like, what's the best methodology, the best intensity, what is the right dosage. I mean, we kind of have an idea from these studies that guide us, but we certainly need more. And also the outcomes. What are the salient outcomes? One thing that is not well documented that I see routinely as an outcome is that the kids are happier. And because the kids are happier, and not just happy-go-lucky, but they're happier, they're more cooperative, they're doing what is expected more typically in daily life, and the families are happier and life is easier. And I think that we need to do more to capture that, because I know I have 3 children, and what's the most important for me? I mean, first of all, that my children are happy, and second of all, that they're productive, they lead a meaningful life. So if we could capture that, I think that we would, in future studies, I think that that would also be a very important outcome or finding.
Thank you so much. That's great information. Next question we have, is there any correlation between sensory integration deficits and lack of skin-to-skin contact with newborns and their mother?
That's a good question. If we're looking for the science in OT, I don't know any studies. If we look at animal studies, and if we look at studies coming out of neonatal care in medicine, we certainly have seen that nurturing touch, and not just any kind of touch, because we know that the perfunctory get them clean and feed them doesn't work, because we have some pretty, I guess, horrifying studies from children with environmental deprivation. So we know that that minimal kind of just perfunctory caregiving, that's not it. But nurturing touch is critical for survival. And so in the absence of that, animals will die, and humans do not thrive. So we know from a really basic level of science that the nurturing touch is really critical. But as I say that, we also know, and I worked for many years with infants and children with visual impairment and blindness. Many of them had a very rough early history where they were so medically fragile that tactile contact wasn't possible because it was life-threatening. So I guess if people are listening in on this, I don't want anybody to think that if you put your baby down for a couple hours in the day that wasn't had any detriment, or if you had a very high-risk infant who was fighting for their life in those early months, that there's no way around that, because what we know from the neuroplasticity literature is that the human nervous system is remarkably plastic and resilient. And so with the addition of nurturing touch and caring later in development, that you can remediate some of that early loss.
That's great. Thank you for that. Next question. Does a sensory integration issue identified in childhood ever disappear with maturity, or is it something that stays with a person into adulthood?
Well, I think, I said that on the little film, that there is this theory, a developmental theory of they'll grow out of it, that you have this neuroplasticity based on maturation and genetic unfolding. And there's something to that. Certainly that is one type of neuroplasticity that the individual will unfold, and in a reasonable life they just start to do, they acquire the skills that they have, they've been born with. But I'm also old enough to know that many children do not grow out of it, and we probably all know adults that struggle with maintaining an orderly and productive life. And what I have seen is that as kids get older, life gets harder. Now maybe they can cope or compensate because they're bright or because they have a great mom or a fabulous teacher. So we know that, you know, some kids will thrive because they have that one or two people who really believe in them and they support them. But you know, it's at a big cost. It's a big cost. When we see these sensory integrative problems early in development, you anticipate that challenge is just going to make everything about life a little harder. And for me as an occupational therapist, I really struggle with the wait and see or let them grow out of it because we know we could repair a lot of that you eliminate the struggle, you close the gap between what one child has where they're falling behind their peers in one or more really significant areas, and versus helping them keep up and making life easier for them at the get-go. I'm going to say one more thing about that. Just recently I was very privileged to be part of a group that reviewed all of the literature that we could find, the good literature, the research on 0 to 3 early identification and intervention with autism. And the conclusion of the review by this really amazing group of professionals was that those children who received intervention services early, they did better. And it was very conclusive, and it didn't, I mean, in this particular review, it didn't matter if they were getting a certain kind of therapy over the other. You know, we weren't trying to separate, oh, did they get an early education program, or did they get one-on-one OT, or did they get a more psychological approach? But when we looked at it as a whole, it was very clear that when problems are identified, even if it wasn't identified right away as autism, if these problems were identified, those symptomatology, and they got therapy, those kids had a better trajectory longitudinally than those kids that didn't. So I'm very convinced that we need to get in early, we need to identify early, and if you get them early, you're looking at a lot less therapy than if you wait. And then you have so much other things, or the gap between typical and atypical development gets wider.
Yeah, that's an important message, and I think it's a good time to remind people that there's many, many therapeutic places around the country that offer free screening. So it's a good way to kind of get information and have an expert take a look at your child if you have any questions.
That's a great idea, yeah.
All right, let's see. We got a lot of questions here. Next one in line. I have a 3-year-old with tactile sensory integration issue that cannot tolerate long sleeve shirts. This is becoming a big problem with cold weather approaching. Do you have any suggestions on how to cope with the wardrobe change?
That's so rough. That's so hard for the little ones that can't tolerate it. And I know, you know, I think there's a couple of concerns, because I can throw out ideas like, well, have you tried a lycra shirt? Have you tried a cotton shirt? Have you tried this kind of, and that gets expensive. And then, you know, you've got a 3-year-old that one day they go, oh, it's okay, and the next day then it's not okay. So what I would have to say is that it's a lot of trial and error from day to day. And if it was my child, what I would do first of all is I would try to eliminate all the potential toxins from their diet, you know, and that would include sugars and dyes and additives, any of those things. Maybe things that, you know, bother in some people's nervous system, like gluten and casein, and I know that's not for everybody. Okay, so I'm not saying everybody has to do that, but first of all, get their nervous system as calm as possible. Establish a routine in the daily, day-to-day where this 3-year-old can predict what's going on around them. They know, you know, they have a nice wake-up routine. They have a nice bedtime routine. They have a nice nap time routine. They have visual reminders, because that's just going to calm the nervous system overall. And then secondly, A lot of time for free play, a lot of time for body-centered play, like rolling around in the grass, and I know if it gets really cold, maybe it's rolling around in the snow if you're in Chicago. In California, it might be rolling around in the sea or in the sand. But, you know, rolling on grass, on a hill, you know, lots of opportunity for gross motor play, because that's also going to be inhibitory to that over-responsiveness to touch. And then, as hard as it is as a mom, because I know I used to say this to my kids, I'm cold, put on your jacket, right? And so maybe letting them feel a little bit of the cold, and I mean you can't put a 3-year-old out in bitter weather without clothes on, but letting them have a little sense of the cold and then putting the jacket on, rather than trying to do that in a hot house. You know, so you have your house all warmed up, they don't feel cold, and then you go, okay, well, let's, you know, look at the car's cold, now put them on. And maybe they're going to be a little more cooperative as they come to the perceptual understanding with their own body. But as I'm saying that, I also know it's a challenge, and you have to protect your child from the cold. But I think maybe thinking a little bit out of the box, or maybe giving them a nice hot bath and a nice massage if they like that before you try to get the clothes on.
These are great suggestions. And, you know, thank you everyone for all your questions. We have so many, but with the time constraint on the webinar, we're not going to be able to get to all of them. But luckily, there's been so much amazing information that you've shared, Susanne. Thanks to everyone for your great questions and for attending the webinar. If you're looking for more sensory integration resources like brochures, handouts, videos, and checklists about sensory integration, look at the SI section of our website at pathways.org. And Susanne, I just really want to thank you for taking the time and sharing all of your expertise with us.
Well, thank you, and I appreciate so much of what Pathways does for families and all of the resources you offer. And it's been such a privilege to be able to do this with you today.
Well, thank you so much. Pathways is a not-for-profit organization. It is through the generosity of donors that we can offer these educational opportunities for free. Thanks, everyone.
Bye.